So I was hoping today that we could talk a little bit about your impressions from the show so far. What are kind of the hot topics that you're seeing really resonate?
Well, what's really exciting is this is actually my first time at RSNA, so it's been absolutely fantastic to be able to go out and see the different vendors and all the new functionality and modalities and technology that's coming is just amazing. Some of the hot topics that we're hearing a little bit about is with some of the changes that are going on in healthcare as a whole, which would be, accountable care, for example, and how radiology is going to be affected by accountable care, and what some things are changing currently, how they're changing currently to be able to manage the accountable care requirements that are going to be coming out here shortly. Image exchange is also one that we're hearing a lot about. You're hearing a little bit more about cloud technology, that kind of thing as well. That's been really exciting. A couple different things. Some of the different vendors are showing some of their new and fun technology. Was very impressed with some of the different vendors. I saw wireless ultrasound. That's amazing to me. That was, the first time I've ever seen that technology. In fact, I think this is the first RSNA where wireless probes actually have been shown. So that's pretty neat and unique for sure.
That's great. So, kicking off the keynote this year, Dr. Brissett was kind of challenging radiology in terms of being more visible, getting deeper into specialties, and kind of raising the game. Yeah. Are you hearing a lot of that discussion continue throughout the show? Yeah, absolutely.
Radiology as a whole is it's interesting how it's all worked up to this point. Radiology has kind of transitioned a little bit over time, and what I mean by that is, in the past, I think way back when, radiologists were kind of in the forefront, and they worked very directly and very much with the actual patients, and that's kind of changed a little bit. Now it's, now that it's kind of transitioned to more of a fee-for-service type scenario, you're seeing that the radiologists are in the back far corner of the hospital somewhere reading, and nobody really has that opportunity to interact with those radiologists.
Right.
And I think that might be something that we'll see a big change.
Kind of more of a push into patient engagement.
Absolutely, and I think that's important. I think, from a parent's perspective, I've got 5 kids myself, and I went in the other day to the doctor. They took an x-ray of my son's knee, and the doctor came in and kind of gave his interpretation of what that x-ray looked like, and then 5 days later I got a bill from the radiologist. Wow. And I thought to myself, well, I didn't even talk to him. I didn't ever interact with him, but I got billed from him. Right. So I think that is something that needs to change. There could be a shift from that type of model. I think we'll see that, especially with accountable care becoming more important.
Sure. Well, I want to thank you for coming by and offering your perspective.
No problem at all.
It's great to have an RSNA newbie here.
Yeah, it's fantastic.
That's wonderful. So I hope you've enjoyed it and we'll leave inspired.
Awesome. Thank you very much. Appreciate your time.